everybody, and a very warm welcome to This is Simulation, the series brought to you by Sim & Skills, which champions the latest innovations in healthcare simulation. I'm Nicola and I'm your host, and throughout this series I get to speak to some fascinating guests who are leading the way when it comes to advancing healthcare training. And today I have the pleasure of chatting with the authors of a brand new book, Practice Learning Through Simulation, a guide for nursing academics and facilitators. So a huge welcome to my guests today. I'm really pleased to be joined by Nicole Pollock, Stephanie Banfield, Hannah Gray and Sarra Anderson. So we're going to be discussing the book today and your experiences of delivering simulation. But I think a good place to start is probably with you guys. So you're all nursing educators at Canterbury Christ Church University. Nicole is the editor of the book. I'm going to come to you first. Can you talk to us about what your clinical background is and how you came to be an educator?
Sure, absolutely. So I've been a nurse since 2007. I started my training in 2004. I predominantly worked in primary care. I worked my way up to become a sexual health nurse, but always had an interest in education and in supporting, mentoring students. So decided to come over to academia. And I've been in academia for the past 11 years. Most recently, 9 months ago now, I was the associate head for practice learning, simulation and immersive technology. And more recently, I've been promoted to the associate dean of education. So a very new role, looking at student experience and outcomes as it relates to academia.
Fantastic. So yes, you're newly embedding into a new role.
Very much so, very much so. So, but very enjoyable and what I'm passionate about. So coming from nursing and supporting students throughout my career.
Fantastic. So Hannah, do you share a kind of similar background in nursing?
So I actually, my background's critical care nursing. So I've worked in both adult and paediatric intensive care environments. And for anyone that's worked in those environments will know education is a really, really big part of those environments. So it felt a very natural progression when I was offered a secondment at the cardiac ICU Great Ormond Street education team, and I just fell in love with teaching, especially bedside teaching, but I felt I wanted more, so that's when I naturally progressed into academia and lecturing at universities. So I started at Canterbury Christ Church almost 3 years ago now, and I absolutely love it, and it's been amazing to be a part of working within simulation, especially because I draw a lot of that experience from my time as an army reservist. So in my quote unquote spare time, that's what I do, run around in some fields for a bit, providing ICU care in tents, essentially. And we do a lot of simulation in those environments. So it's been really lovely to bring that experience in as well.
Yeah, no, that's great. Thank you. Sarra, come to you. So what's your nursing background?
Hello. So I qualified 2014. Whilst I was a student, completely fell in love with acute medicine. So that's basically where I spent all of my time for about 10 years. AMUs, SDECs, that sort of thing. Lots of helping out in A&Es. At the back end of that, I took on a role in workforce development where I was teaching post-registered nurses and preceptors, updating those nurses in the trust, and completely fell in love with teaching. So then saw an opportunity at Christ Church and came across to academia about 2 years ago, and have basically just been doing simulated practice with these guys for the last 2 years, and absolutely loving it. Really like using my nursing knowledge in this new environment. So that's me.
That's great. So Stephanie, did you catch the teaching bug as well? It sounds like everybody's kind of a love of clinical practice, but the teaching bug's gotten hold of them.
Yeah, I started out in nursing in hyperacute stroke and stroke rehabilitation. And in fact, I loved stroke and rehab so much that I stayed there for the whole of my career across different trusts and different organisations, doing all the variety of different roles, with the last 8.5 years of my clinical career as a practice development nurse in stroke. So I was training nurses to be specialists within the area, which was my absolute passion. In 2022, in January, I moved across into Canterbury Christ Church University, and you could sort of see the differences between postgraduate simulation and undergraduate simulation. But it was really relatable, and it's such a good learning tool that's where I sort of moved across in. Oh gosh, when was it? Years ago now, I think 2024. I moved into the subject lead for simulation in nursing role. And we sort of started working in sim. We realigned quite a lot and developed new curriculums within simulation, and it's just an absolute passion really to be able to work in simulation and to see the learning journey that students take within it. So
it's so great to hear how you've all got such diverse nursing backgrounds. There isn't just one route that you've taken in nursing. Do you feel that feeds into your teaching, that you've got all these different perspectives as a team that you can bring to your students?
Absolutely. Yeah, and our team in simulation is so diverse as well, with their backgrounds and experiences, that it really helps with sort of developing simulation, but also imparting those aspects of knowledge onto students, so that they get that variety. I'll pass it over to the others, but I think they'll agree.
Yeah, I agree.
Yeah, I think that's unanimous. I think it's unanimous, and I think it created the strength. Sorry, it created the strength with the book, because we was coming at it from so many different angles. So I think that variety was kind of the spice of the book.
That's great. Sorry, Sarah, did you want to add to that?
I was only going to elaborate on the comments already. I think the students appreciate the variety of backgrounds as well, and they've said as much many times that they appreciate that we all come with different scope. We're all very honest about what we do and don't know, but all of us have got a really nice broad range, and we all cross over. So throughout their experience, they get to kind of pull from our own experiences as well across lots of different areas. So yeah, and they do say as much, so that's good.
And it all sounds like you very much got a passion for teaching and teaching your students. Was that part of a drive as to why you wanted to write the book? Because with the book, in essence, you're helping to teach other facilitators as well. And do you feel like this is the book that you wish you had at the beginning of your educator journey?
I think if you think about the drive to write the book, it really come from a moment of reflection as a team during curriculum revalidation. So at our organisation, we were revalidating for a September 25 curriculum, and we were asking ourselves a kind of simple but powerful question. And that was kind of, how do we prepare our students for that moment when absolutely everything matters? So if we think about if a patient deteriorates, when a family's scared, or when a nurse or a healthcare professional has to make that decision that can change your life. And traditionally, we all know that students had encountered those moments for the first time in those real clinical environments. And certainly we were reflecting on our own training, and that's when I had to learn those critical skills. But it's really high stakes. So while we was looking at the curriculum, we started to think, how can we prepare our students better? And what if we could create some spaces that they could really practice those moments safely, and where that learning can then become confidence? And obviously with the NMC validating up to 600 hours of simulation, we really decided to try and bring that to life, not only as, not just as technology, but kind of meaningful and an immersive learning. So we, over 12 to 18 months, we developed 600 hours of simulation because we realised we were doing something quite significant. We decided that there wasn't any resources that captured it, and I guess that's where the book come from. So absolutely, it's the book that I wish we had at that point, and I'm sure Steph, Sarah and Hannah will agree with me, because they're doing this every day. But we wanted something that kind of brings together how and why we're doing what we do, you know, the pedagogy, the philosophy, and that confidence to be really creative, but within a safe, evidence-based environment.
Sarah, would you agree with what Nicole said, that was the drive behind writing the book?
Well, I will put the, Nicole was the driving force behind this. I was invited in and quite happy to be invited in. But as a nurse coming into education, the teaching I was doing in the trust was more traditional, more kind of classroom presentation, and then we'd kind of enter into the skill area. But then coming over to academia, where it was very specific around sim, and I'll let Steph go into more depth, but we have for it to be simulated practice, we have quite a lot, there's a lot of rules that we have to stick to. So it was a big learning curve coming from the traditional type of teaching into simulated teaching. So yes, in a nutshell, a book like this at the beginning would have definitely kind of got me around that curve a bit more quickly. I've caught up, obviously, but it's a very different environment to teach than a traditional situation. And I think if you've not done simulation, you would not kind of have that understanding yet. So to have that book for those coming in or wanting to come in, 100%.
Hannah, it sounds like you are fairly new to simulation education. So in writing the book and reading what the others are writing as well, was that a huge benefit to you?
Yeah, I think so. I've always been a part of, throughout my sort of career, I've always been a participant in simulation, and I've always seen the benefits of it. So I was really keen when the opportunity sort of came up at Canterbury Christ Church to be more involved in simulation. I was like, definitely want to be a part of this because I know the impact it's had on me and my career and my education. I wanted to, see those benefits for the students. So when the opportunity then also came to sort of write this book, it allowed me to really unpack and see, like, okay, why are we doing these things? What are the reasonings behind the different choices of fidelity, for example? How can we design simulation that also takes into account some of the barriers and challenges we come across in implementation? So, potentially lack of resources or, lack of space. How can we use the knowledge we have to potentially overcome those as well? So actually, writing the book not only sort of helped me sort of consolidate my knowledge, but also develop it further, probably in a way that I didn't realise it could or would.
And to come to Stephanie, Sarra touched earlier on about the NMC's changes to simulated practice learning and how you can have 600 hours of placement time in simulation. And that's something that the book looks at and addresses. Do you think the sector is generally ready for that? And in your experience, what have you guys had to do to get yourselves ready to be able to deliver this 600 hours?
I think the sector has a really clear understanding of what simulation is in pre-registration nursing. 600 hours is a lot, and I think the readiness would vary from institution to institution. It's not just creating the simulation, it's looking at your timetabling, your infrastructure of your resources, so rooming, staffing, are your facilitators ready and up and running? And there's a lot to consider when sort of coming up to the 100-hour challenge. And I think timetables are one of those challenges. You're balancing practice, you're balancing theory, and then you're using simulation as that bridge between the two. So creating 600 hours, it has to be meaningful to the curriculum. It has to make sense within your learner's context. I think different institutions are at different levels of readiness, and I think that's why there's the varied uptake between the 600 hours, and not everybody is going straight for 600.
And in your book, you're looking at almost step-by-step guidance for how you integrate simulation into the nursing curriculum. From your own experiences, where do you think nursing educators are encountering barriers in terms of integrating simulation and then taking it a step forward and making it simulated practice learning? Because there is a difference, isn't there, between what is simulation-based education and what is simulated practice learning?
So yeah, there is definitely a difference between just doing simulation for a purpose of sim and having it as practice learning. I think gap analyses generally tell you where there's areas of hard to reach areas in practice that potentially students don't get exposed to on a regular basis, that actually they're going to need when they go out into that preceptorship, when they go out into the real world working, that actually simulation has a place for. So you can really enhance that learner's ability. Barriers, there's sometimes getting your student over those barriers, them not thinking it's real life sort of simulated, real life context, and actually allowing them time to deconstruct and do different things. That's often a hurdle that you sort of overcome quite quickly with them. And Sarah wrote that chapter on barriers. I don't know if you want to come in there, Sarah.
Yeah, I think for barriers, we've already touched on, I think Hannah said about, or one of you guys had said about, having the facilities, the space, the equipment, the mannequins, to be able to actually have meaningful and interesting and exciting simulation. And not everyone has that, so that could be a big barrier. We're fortunate at Christ Church, we've got a really good facility and it's a lot of fun and we get a lot of good experiences for the students. I think simulation isn't just about running sim or just having a go at simulating an episode. The skill of the facilitator needs to be fine-tuned. We need to be confident at pre-briefing, creating safe spaces, debriefing effectively, and that is a skill in itself, and that's something we have to take pride in as facilitators, and really for it to make it, the simulation the NMC wants. So that's a bit of a barrier in terms of making sure the facilitators are trained properly to create that space in a professional way. One of Steph's biggest challenges she touched on there is trying to fit it all in. 600 hours has proved to be incredibly difficult, and Steph has a lot of time spent trying to fit that into the curriculum. So yeah, I think, and lastly, she'd said about the students in the room and that feeling of, is it real? I've got to say, when I first was doing simulation, that was one of the biggest things I was encountering in the room, was the students would often say, well, this isn't real. So we've learned now that a part of our kind of repertoire on the day is we call that out straight away, and we understand that it can sometimes take them time to appreciate the quality, what they're going to get from this. But often that kind of barrier or that attitude sometimes comes from perhaps lack of preparation on the student's part, or just anxiety, and they're just worried about being in the room and kind of acting out things, so they kind of throw barriers up. So we kind of call it out and say, yes, we're going to step over that and we're going to use what we can in the room, and we just really try and nurture that safe environment and say we understand, and we try and bring them forward and encourage them to kind of enjoy the moment, give it a moment, just think about, for example, I think in my chapter I'd identified a few clinical interventions that are particularly useful in these moments. For example, catheterization. Catheterization as a clinical intervention is actually, there's a lot of plate spinning. You've got a lot of things that you need to be thinking of as a nurse. You've got your ANTT to keep the patient safe. You've actually got the intervention itself of inserting a catheter. There's a lot that you're thinking about in one episode of care. And to have to do that directly with a patient, as I think all of us probably did, I mean, it's a big responsibility. There is risk associated with that, with catheter-acquired UTI and all those other things that we need to be thinking of. This gives them that opportunity to just practice it over and over. And that's, the value in it. They do see that eventually. And you're like, just imagine if you didn't have this in-between stage and you had to do this with a patient, and they're in. Once they're in, they get a lot out of it. So, yeah.
Is that psychological safety aspect of your simulation, Nicole at the beginning talked about the reason why the book came into being is because you're reflecting about the courses that you're delivering, and you're saying about, you want to create this sort of almost parity, that when students walk into that simulation, they are treating it the same as if they were going on to a clinical ward, but you've got that level of performance to it because you know that you're being observed. How do you kind of work through that aspect of psychological safety within simulation so students can develop that confidence in their practice?
Yeah, I mean, for us, psychological safety isn't something that's only developed on that morning of the simulation or that afternoon of the simulation. We try and build that already for our learners before they even enter that sim suite for the day. So we use our virtual learning environment to actually outline to the students the sort of scenarios they're about to see, some of the learning opportunities and learning outcomes that they're about to go through, and main aims for the day. So they already realistically know what they're about to walk into. And I think that's part of that building that psychological safe space, is that there shouldn't be any surprises. It should be that the learner knows what they're there for, knows what the intent of the sim is. And then we also give them sort of a bit more external pre-briefing, so they have sort of some background information and some work to do prior to going into the simulation. We try and make that engaging as possible, so it's not all sort of reading and listening and things like that. So we sort of mix it up a bit, and it does depend on the simulation to what they need to go into that sim. So hopefully they're already partially prepared before they enter the room with us, and then we use that first sort of 30 minutes of that simulation to really embed that pre-briefing, sort of find out what they've learned from the information they've had, reiterate those learning outcomes and the intended goals for simulation. We build that safe space, so we tell them this is an environment where you might make mistakes, and that's absolutely okay because this is simulation. The risks to patients here are zero, and if the mannequin somehow doesn't quite make it, we'll turn them on and reset them in 2 seconds later. But it's about building that space that they know they can trial things. And sometimes we have third years that like to go, actually, I had this kind of scenario in practice. Is there any way that we could see what the other side of that would be if we did this differently, or if I responded this way? So sometimes you've got that ability to have that adaptation, but it's about giving them that room to be able to make those connections, to be able to see that actually this is a safe space. This isn't, you're not going to be judged. We know you're intelligent. We know you want to do your best. We know you want to learn in this space, and that's really what we try and give them when they walk in.
I can add a little bit to that as well. I think there's this massive misconception from facilitators and from students that sim is an assessment, it's to test you, and it's not. I think, there are some instances where you have exams, it's OSCEs and stuff like that. They exist, but simulated practice learning is not that. We are not assessing. It's very much about allowing them to learn skills, practice skills in that safe environment. And it's letting them know that from day one, the day one that they step onto the course, that this is what simulated practice learning is. It's not an assessment. It's a place for you to learn and develop. And then hopefully once you get rid of that idea of exams, assessment, it really helps them feel safe in those environments, because realistically you don't learn anything if you don't know what's coming. Like if you know, a lot of the time in sim they're like, oh, let's make this happen and let's make this happen, and yeah, that can be fun, but you need to prep the students and build them up to that point. You can't in their first sim just go cardiac arrest and they not know it's coming. They need to know which simulation they're walking to is the cardiac arrest simulation, because then they're not going to learn from it. They're just going to panic and freak out, which is obviously the opposite of what we want. So actually letting them know what they're walking into, how they're walking into it, what we're looking at, what they should be looking out for, really creates that safe space we really want.
I really think it's about creating those communities of practice as well. We have worked really hard over the last few years to work as close as we can with our practice partners. We have clinical academics, so individuals that work out in the community but come in and deliver teaching. So students are seeing that we have those professional working relationships. They recognise staff both when they're in actual clinical placements or if they're in simulated practice learning, and they see that we have those professional working relationships. And I do think that creates a real element of psychological safety, but it also brings that realness into the simulated classroom.
Because within the book you talk about having a hybrid approach. So obviously simulated practice learning is relatively new, but practice learning isn't, and combining those two things together as a hybrid allows students to have more equity of experience. And do you also find that you can use simulated practice learning to almost deconstruct what's been seen out on practice, to further investigate what they've seen, but also from a psychological safety aspect as well, that they can reflect and go through something, particularly if it's been quite a difficult experience?
Absolutely. I think it's about teaching the gold standard and that evidence-based practice element. And I know it's probably Steph, I believe, that's going to want to come in and talk about the debrief and the importance of that debrief and having that space to deconstruct and reconstruct their knowledge based on what we're delivering on the day.
For us, the debrief is definitely one of the essential parts of simulation. And I think that's really where it contextualises all the learning for the students. It builds that. It does build that bridge in that moment so they can start to see these sort of singular things they may have been doing or thinking. It is actually a bigger picture here. It's, you know, it relates to what they've seen in practice. It suddenly makes it real for them, and it gives them that space to explore it within debriefing. So and they can really sort of deconstruct, but actually reconstruct their thinking. We often get a lot of changed opinions throughout the process of debriefing as well. The more that it starts to evolve, the more that things start to unravel and work out for the students. So it's often they go into the sim with one very fixed opinion and come out with something very, very different, which I think is the beauty of tying that debrief in and making sure that it's actually a worthwhile debrief and not just a quick summary of what you've been doing, that they actually do explore and allow themselves to ask the questions, but ask them of themselves as well. So exploring those human factors and why did I feel like that? Why did I think that originally? What was that based on? And us as facilitators, you know, we're there to guide them through that process. And it's handy doing it with another person as well. I think there's definitely merit to the two-person debriefing so that students get that sort of contrast and you can feed off of each other. But it's
just add to what you're saying there, Steph. I think what's really important as well is that yourself, Hannah and Sarah, are doing this work every single day. Yeah. So, you know, we wasn't just writing about simulation, but what you're doing, you're kind of living it, you're testing it, you're refining it every single day. And I think that brings a real strength.
So going on to some of the specifics of the book. So we have touched on this a little bit. Stephanie, you talked about in one of your chapters that there are key considerations that faculty must undertake when they're designing simulation for nursing students. But there was something you mentioned earlier on about faculty themselves, like they need to be almost, you need to view simulation as a complete pedagogy rather than just a modality, because you've almost got to live and breathe it and really be quite passionate about it to be able to deliver it to the students.
Yeah, absolutely. Simulation needs to be seen as a teaching method, and it needs to be not seen as add-ons or niceties or things like that. It is a teaching modality. And people have to invest in it, just like you have to learn how to deliver a lecture or you have to learn how to do seminar activities. Simulation is a different modality, is that different aspect of pedagogy where actually people need to understand how to not only deliver it, not only write it, but also how to debrief, how to facilitate the room, how to observe when you're engaged, when your learners are more engaged or less engaged in different activities, and be able to field those moments as well. So there's definitely a lot that a facilitator of simulation or a teacher in simulation actually needs to understand when they walk into that classroom. It's, you can prepare, but actually on the day you also have to adjust. You have to manage your room in a different way. If you've got lots of different learners doing different things, you need to be able to focus on different aspects and pick up pertinent points, and then bring it back into a debrief, so that it doesn't look like you've highlighted a particular person, but actually you've brought out that learning for everyone as well, and you point it in different directions.
Would you all say that, so particularly with simulation, there's almost a reciprocity thing that's happening between you and the students, where you've got to adapt curriculum as you go, because you need to reflect upon where the students are at any given point. And in the book, you also talk about different learning styles and how important it is to adapt to students. So how does simulation benefit that approach of thinking about individual student learning styles, how you can combine that so that everybody benefits, and how you kind of have to adapt things as you're going throughout your term, because you're having to react to the progress that the students are making?
I think that's why we all love simulation so much. And I think me and Sarah literally talked about this the other day, how the reason that simulation is so rewarding as a facilitator is that no session is the same. More often than not, you're running the same session again and again and again, back to back. And you're often, people often ask us like, oh, don't you get bored? You're like, no, because it is different every single time, because you've got a group of different individuals in front of you. And simulation is so flexible and adaptable, and if you have those skills as a facilitator to be able to feed off that with the students, you can change and adapt the simulations and scenarios based off what they're giving you, which is sort of the beauty of it all. When it comes to neurodiversity, I think simulation in some aspects really lends itself really nicely to neurodiversity, because you can have those different roles within the environment. You can have students that are the active participants. You can have active observer roles. So I think a lot of people don't realise the impact of, it's not just about simply observing. It's really important that you guide that observation so they know what they're looking for. But, students can learn a lot from watching and observing. So if you've got a student that's a bit more nervous, bit more apprehensive, or is maybe struggling in that environment, finding it a little bit overwhelming, observing and watching initially, maybe those first few simulations, so that they can build that confidence, learn from their peers. Then they could come in later and go, oh, actually, no, I can do this. And a simulation provides that flexibility, whereas maybe those traditional learning environments might not have them so much. I think that's the beauty of simulation.
The lack of formal assessment, that I think is what we benefit. We benefit greatly from that, because we can flex on the day. As long as we're sticking to our learning outcomes and we're doing what we should be doing on the day, and it's gold standard, I think the skill that you build as a facilitator is about that intuitive feel and being able to see where you need to kind of pull a little bit more. You can kind of see where the vibe comes up and down. Where do I need to take this? Do we need to labour on something else a little bit more than we'd had expected? Actually, they've got that much more quickly than I thought. And this has turned out to be something they're finding more of a challenge, and we can flex that way. And that's the beauty of not having that formal assessment and feedback. It's very in the moment, reactive. So that's a real pleasure. And that's what Hannah and I were talking about the other day, is that, it never gets boring. No two sessions are ever the same. So it's great in that respect.
Nicole, would you like to jump on that? Because I know in your chapter you talk about modifying teaching to meet different learning styles and how important that is.
Yeah, I think it's incredibly important. I think the girls have touched on everything that I would want to say. I just think as well, it's about inspiring students, and I think we're really fortunate at Christ Church. We have some really inspirational lecturers and clinicians that deliver on this, and I think that really adds to that kind of shared philosophy and that creation of that learning environment where, as I've said already, students feel safe enough to learn, and a braveness as it relates to failure as well, so that they can grow.
So one of the things that you touch on in the book, obviously you're all nurses. Nurses don't work in silos. There has to be a lot of interprofessional team working, working together with people from other professions where you've got to all work around the patient together. How do you feel that with simulation that you're able to develop this, and how do you manage to coordinate that in your university where you're having to work across different disciplines and cohorts to create practice learning scenarios where they're having to interact with other teams?
It's challenging.
I was going to grab that one and give a real kind of corporate answer. We do have an interprofessional an interprofessional education strategy. So we do have an IPE strategy for our school, and we've recently merged together to become 2 schools. So we're the School of Nursing, Midwifery, Allied and Public Health, and we're recently setting up a dental provision as well. So I think again it's that teamwork, and it's relying on our influences, our input and our connections with other healthcare professionals within our school.
I think the key is, yes, it is challenging, but it is worthwhile. And what sort of Nicole's saying is, by us having that embedded within our school already, we're making it the norm. And that's what it needs to be within simulated practice learning. It needs to be the norm. When we're writing simulation, we're always thinking, oh, who could we bring into this? Like, how could we include certain professions as the students, but also as faculty as well, helping and supporting? Even, you can sort of divide it into different sections in sort of not just the development of simulation, but you can think about the delivery, but also actually within research as well. Can we use this to research our approaches as an interdisciplinary perspective? So I think it really does come down to, how can we make this the norm? How can we, when we come to develop sim, just automatically go, how can we make this interprofessional? And that could be through development, it could be through delivery. So there's lots of different ways we can incorporate that.
I think in my role as a facilitator, and when I'm not actually in the sim suite, I'm writing, culturally where we work, it's expected that we just reach out to our interprofessional colleagues, and that's been really nice for me. If I've been given a subject to write on, I can go out and just reach out to the mental health team or the child nursing team and just say, oh, I've got a kind of a little piece of this that I'm not quite sure on, can have a chat? They're learning that on a personal sense and professionally in the last 2 years, because we do deliver across pathways, adult, mental health, child, and to all year groups. For my development, God, the amount of stuff I've learned just because I have to know it to be able to deliver it. So I want to appraise myself fully of everything. So, but it's culturally accepted that we should be reaching out, and we do talk to each other across pathways. And that's been actively encouraged for me by my seniors. And that's a really lovely part of this role, is that kind of independence in terms of creating scenario. As long as we are within the NMC requirements, we are delivering the learning outcomes. It's nice and creative. I mean, it's making me a little bit more creative, and I'm not very creative. So the others are laughing because I'm really not very good at the creative side. So it's really made me kind of think outside the box about stuff. So the cross pathway, cross year group thing, it's a really fluid process. It's nice.
And that's what we want to emulate to our students, isn't it? The role modelling, that we are able to reach out to talk to different professions, to be like, hey, if our lecturers are doing it, just naturally the facilitators are doing it, you know, they're going to go, oh, I can go up to that doctor on placement and talk to them and ask questions. We are one team. So if we're able to show that as a faculty, it's something we can also emulate, you know, to our students as well.
We mentioned slightly earlier on about developing a community of practice around simulation, and as part of your book, you very kindly included some lesson plans for scenarios in there. And you know, you say about creativity and flexibility, and obviously you've got to what you've got to teach is written down in NMC, but how you teach, that kind of pedagogy, is where you get your freedom and creativity. So what would you want other educators reading the book to kind of take from those lesson plans and how they can guide their own scenarios?
The lesson plans we wanted to include so that people can reuse them and you know, manipulate them to support their own development of their curriculum or of their scenarios or of their simulation session. So we really wanted it to be a resource so that people could actually take something practical and tangible from the book. And if we look at the kind of writing and research process that we took, we really did bring together, when we was redesigning our curriculum, not only nursing academics, but clinicians, simulation specialists and educational leaders who all supported us when we were designing the simulation in practice learning. So these lesson plans, while the girls here have designed and delivered them, they're really giving you a kind of rich blend of perspectives as it relates to simulation, but also Annex A and Annex B skills that the NMC talk about, and really bringing them together. So what we did do is, to keep it really grounded in real patient care, is we mapped out how each simulation session would meet the Annex A or the Annex B standards. So the design, facilitation and even the debriefing really meets that professional, statutory, regulatory body requirement. And the girls here really ensure that absolutely everything was underpinned by that strong pedagogy and evidence. So those lesson plans are there, like I say, as a resource for other people to use.
I would also like to think that they also inspire people that read them to know, yes, it's really fun to write a sim that's all bells and whistles. You know, we've got a pandemic sim in there where the students get proper all dressed up in their PPE. We have like alarms go off to say the oxygen's running low. They're all really good fun, but you've got to be able to balance those out with those other simulations that deliver those more skills around human factors, that, you know, those quote unquote soft skills. They're just as valuable as and important. So we have a simulation lesson plan also around difficult conversations. So in there, conversation with a palliative patient, breaking bad news, also, you know, whistleblowing. So how do you have a conversation with someone that you know is not doing something right, but you need to critique that and support them to develop as well? They can be really challenging. So being able to create simulations that, you know, yes, we can have the fun, you know, that, you know, bells and whistles, explosions, all of that, because I love that. But we also need simulations that, you know, they can develop those other skills that are equally as important, if not more, to an extent. You know, they're probably more likely to be using those in practice. So I want facilitators that read those lesson plans to realise actually simulation can be valuable in a variety of modalities, low to high, as long as you've got that variety. But if you're, you know, exploring those different skills in different ways, you know, that is just as valuable as and important. And also, actually, when we think about our use of resources and being able to use them effectively, you need to have that range. And also for student experience as well, you need to have a range of different things that they look at and explore.
And I really support that. I think it is so important that we include those. I like to call them fundamental skills. You know, it's a privilege to care for people. And while simulation and simulated practice learning can be really exciting, as Hannah describes it, bells and whistles, actually sometimes the simplicity is the beautiful part and the enjoyable part as well. So yeah,
I think the communication, the conversational ones, for example, role-playing a multidisciplinary team meeting, those sorts of ones where there's a lot of human factors involved, they will learn a role, sit in the room, have the conversations, and explore tone, how to manage conflicting priorities around a table, often with very senior kind of clinicians all coming to the table. They're part of this, and they and kind of helping them to realise that they're going to be part of these conversations, and practicing words to use, practicing tone. How do I manage a conflicting priority in a room like that when I've got the patient at the centre of what I need to do? Listening to other people talk, the tone, what sounds good, what really wasn't okay, and learning from each other. There's a lot of learning from each other in those moments, which is really nice to see as well. And in the debrief, that's where we pick it apart. What do you think went well? What did you hear that was great? What do you think wasn't so great? And it's nice when they say, we're all sat in a room, and they'll kind of identify one of their peer group to say, I really liked it when you said about this in that sort of way. I think that I hadn't thought of it that way. And that's what those sessions, the beauty of those sessions are, when, you know, I guess we like the exciting, or, you know, bells and whistles ones, but actually there's so much value in learning how to be part of a difficult conversation, and tone, when to step in, when not to step in, you know, how to manage challenging, and being in a room full of professionals who aren't necessarily always professional. How do I deal with that? You know, these are all things that they get to have a go at with us, where there's just never going to get that opportunity in practice, not until they're up and running fully and they're actually in that situation. But with us, we can say, have a go. What do you think you might say here?
With us including lesson plans in the book, it was just sort of like a taster of, okay, we've explored different avenues within simulation. It doesn't all have to be mannequin based sim. It doesn't all have to be actor based sim. You can have the variety within different simulations. And I think there's a lot of different pockets within higher education and simulation where people are having these really good ideas for simulation, and there needs to be sort of more dissemination of that. And we're all teaching to the same proficiencies. How we teach it varies massively, and some areas are doing it really well, or in different ways. And I think that joint sharing, I think, is something we're potentially missing. And by putting some of those lesson plans in the book, I think it just sort of shows that we're open for that dissemination, that sharing of different ways of doing things. And
that community of practice probably is what feeds into my last question. So with the book, and there may not be just one thing, but if there is one thing that you would like other facilitators who are reading it to take from the book, what would you like that to be? I'll come to Nicole first.
That's a great question. So for me, it's the art of possibility, that it is possible to reach those 600 hours. I'm not saying it's an easy task, but there is a possibility. And if you have an incredibly strong team like I had, you know, through Steph, Hannah and Sarah working alongside, then the art of the possibility is there, and you can do this, and ultimately our students will benefit the most from it.
Hannah, I'll come to you next.
I think I sort of touched on it earlier, is that simulation, you don't need to think high fidelity every single time. You can have just as powerful and impactful simulations at those lower fidelities, and it's about having a mixture of those. But actually at the end of the day, what the students take from it are more often than not those fundamental skills around human factors. And actually, if you have simulations that embed those, they're going to be the most impactful.
Sarah?
Do you know what? If I had someone come to me and say, I'm looking to get into sim, and I would say, use it. What am I trying to say? I think it's exciting. I'd say to someone, it's actually really exciting to be able to bring your own knowledge, your own experience, and your own personality, and don't be afraid to do that in the room. You've always got what you need to stick to. You're always going to have the NMC requirements. You're always going to have your learning outcomes, your gold standards. But simulation is an opportunity for you to bring your own personality, your own nursing experience, and kind of nurture and bring through. And that's what's so exciting about simulation as opposed to a formal setting. So see it as an exciting opportunity to bring yourself and your identity as a nurse into the room and really encourage people and get them excited about being in practice. I think that's what I would say.
And Stephanie?
For me, I think writing the book was a process for us, and learning those different aspects coming into building a 600 curriculum. I think for me, it's almost sort of wanting to share that with other people that are thinking about this process, that are thinking about going into developing more simulation or different types of simulation, or having that infrastructure, and potentially having the opportunity to learn from somebody else that's already done that as well, and other areas that we didn't consider at the beginning, and maybe we did consider after we'd learned that lesson. So it's more of a sort of a share, I think, of our journey, but also to widen that community knowledge about nursing simulation. There's lots out there about different types of sim and medical simulation and post-registration simulation. But I think undergraduate nursing simulation, there's that gap. There's a lot that can be said there, and different areas to explore.
So, Nicole, really finally, I guess the most important question is, where can people get hold of the book?
So the book is available from Wiley's website, but you can also get it from Amazon, and the girls found it on eBay as well, which fascinated me. I don't know how it ended up there.
So the final thing to say is thank you so much for joining me all today. I really appreciate you chatting with me and talking us through the book and your experiences as well. It's been great to have you all here today.
Thank
Thank
you.
I think